Journey by Grace Global Mission Hostel, led by Dr. Joyce and the team, Dr. Kisha, Bishop Dr. Trace, RICO team, and the large delegation that we are having here today. We are happy to have you here in Migori County as our guests and also as our partner. We are happy to partner with you in this mission of health. When we recall the mission of Christ many years ago, the first indicators of that mission, the first targets that Jesus Christ's work began to manifest itself was healing the sick, kuponyesha wagonjwa. Hiyo ndio ilikuwa, that was the mission of Jesus Christ. We are happy that the journey of grace is about healing the sick. I sat there listening to our young daughter at the university describing your mission as that of hope. I sat down there listening to one of the contributors indicating that you have brought hope and that hope is here in Kihanja. As an administration, we are extremely grateful to yourselves for bringing hope here. As an administration, we have the responsibility of providing opportunity for treatment to our people. We must continue providing that opportunity, doing as best we can, and hoping that God will heal the people we have tried to treat. So I want to thank you for being part of that mission and for being a good partner. This part of the world where you have come from is one part of the world where most Kenyans think that is very far. We in Migori County are treated as a people who are very far from central Kenya, which is basically Nairobi. Nairobi is very far from here. As an administration, we tried bringing Nairobi close to us by putting up where people land. We have an airstrip. So we put up the facilities where passengers are processed so that they come to Migori with ease. We went 2 years ago and sought a service provider, Skyward, to make Migori close to Nairobi where many things are happening. So Migori imekuwa karibu na Kenya. Na sana sana, this place called Kihanja is now close to Kenya. It used to take very many hours to travel from wherever and come to Migori. So most of you who are from outside the county, outside the nation, you may not have had opportunity to come to Migori easily. You would have to drive for 5 hours. That is not to mention the 16 or more hours that you fly from the USA. So Migori is now near, and I want to thank you profoundly for remembering this community. The mission of every government, national or county, is the health and well-being of the people. We want to assume, all of us, that matters of security is taken care of. We want to assume, all of us, that other forms of security, including food security, is taken care of. But life would not be what life should be if you are not healthy. Life would not be anything if you are not healthy. So this project, whose groundbreaking we have done today, is very fundamental to these people. Those of us who have sickle cell, those of us who have that condition, the First Lady of Migori County salutes all of you for being courageous. The First Lady amewasalimu nyinyi nyote for coming here to support sickle cell. Sickle cell in this area is quite prevalent. We need to identify those who have it. We need to bring treatment to them and give them hope the way our two daughters have spoken about it here today. And thank you for doing that. On our part, as an administration, we'll do the best to ensure that all the barriers, all the hurdles you face when offering support to a county like Migori, to a nation like Kenya, are removed so that support would come easily. As an administration, we have 167 health facilities. 143 of them are dispensaries. 19 of those are health centers, and 16 of the rest are level 3 and level 4. 3, is it B or A? 3B and 4 level of health facilities here in Migori County. As an administration, when we started our work, we worked on the repairs of those facilities. We came into office when most of those facilities were in run-down condition. We didn't have water supply in most of them. We didn't have electricity in most of them, and many small things had broken down. Well, we spent a lot of money rebuilding them, repainting them, fencing some. Then we embarked on motivating staff. Our staff, including CHPs, the people who connect those facilities to the public, we motivated them by catching up on paying their allowances. These very wonderful people are not on salaries. They have a small allowance. They are the ones who will connect the needy patients to the facilities. We have also recruited many staffs. We have CHPs, more than 3,000 that are attached to those facilities, and you can see some of them are here. They are trained, very wonderful. CHPs Muko, very wonderful people. They are volunteers, and they support the facilities. So these are very important people. We have also vigorously come up with a program to ensure that medical commodities are in our hostels. We continue to recruit staff, and among the over 300 staff we have recruited, 50% of them, nearly 150, are from the health department, because health is the first thing that we are interested in. If your people are healthy, then they will be productive, then they will be happy and do many things. So that is what we are working on as Migori County. We have many plans, and hopefully we will succeed. We want to welcome you to Migori County. We want to work very closely with you. We have our chief officer here, Mabel Chanzu. We have another chief officer, Atula. Where is Atula? That is also our chief officer. We have our equivalent of secretary. You have cabinet secretaries in the US. We have a secretary here, but he's not here today. He is attending to other duties, so he's also there. These officers just will have you on a fast dial, and you'll be able to work together. So karibuni sana. Let us work closely and support this facility. Let us encourage one another so that our people will be healthy.